Right on. That is excellent. Thank you for encouraging us to the best of our ability, maintain a healthy lifestyle through what we eat and how we move our bodies. So thank you.
And exercise is good for both your mental and physical health. We're all cooped up inside for so long.
Definitely true. Definitely true.
So are there any topics that we did not hit on in regards to autoimmune and the COVID situation that you feel needs to be mentioned?
Let's see. Um, I
Check
think
my
we
list
hit
too.
most of it. The hydroxychloroquine is definitely a hot button issue. What to do with your medications, and the kind storm. Those are the top three. It seems like they come up a lot. Those are really um, questions that
Yeah,
people have that really hit the autoimmune and the COVID at the same time. Specifically. Um, I think that's pretty good. I'm just trying to think if there's anything else that might be helpful. Um, but that's a lot of it now. I'm hoping that we may have some more antibody testing data available. New York City did a survey, and it was, uh, there are a bunch of caveats. Again, it wasn't huge, and we don't know exactly how accurate the test is, but it suggested that 21% of people in New York City had been exposed to COVID, which is impressive. That would be
wow,
more than 1 million people. And it would suggest that our current testing is capturing maybe 10% of the people who've actually had it. So um, I think that might be a good one for next time because I
Only
think we'll have more
10%.
information. But uh, yeah, I mean, I think it's probably because we can't test anybody who's not got symptoms. We've really had to limit our testing to people who are really sick. I think in some ways that's encouraging
right.
because right now, if you just do the math for the number of positive versus number of people who've died of the virus, it's like 5%, which is really scary, and that's higher than a lot of other places
Yeah.
in the world. But I think it's because we're testing only the really, really serious cases that come into the hospital. For people with mild symptoms, the general advice has been to stay home actually. So you might have COVID. If you come in and get tested, then someone's got to get right in front of you and do the thing up your nose, and you're exposing someone. And if you feel like it's just like a cold and it's not bad, then um, there isn't a good way to test besides that swab. And so they've been telling people to stay home. I don't know. Who knows if it's the best thing. It's just what we can do right now. There's a limited number of tests. Um, so I
Sure.
think good news in that is that if that math is right, then it would be less than 1% of the people that are getting COVID that are actually having really serious bad outcomes from it. And that would be good news. And the other part is that it would mean that we're maybe farther into this than we think, and there might be a bunch of people walking around that already have some defense against it now, which every time there's a person in they talk about the herd immunity, that every time there's a person in the herd that's immune, it can break a chain of transmission, so you could have someone that could have passed it, and then if they stop it, then maybe that stops there, and so all those people help us not get it.
Sure.
Um, uh, I'm trying to think what else to talk about. I guess, well, we didn't mention face masks at all. I guess that could be
Ah,
something that we could talk about a little bit because it's a common
sure.
question. If you want to maybe, I mean, I guess asking you to ask me a question. You want to ask a question about that, and
Yeah.
then I can do a face mask response. Okay.
You take this one, Deets.
Um,
Your turn.
okay. Um, so it's been suggested and asked that people going out wear face masks, personal protective equipment, gloves. What sort of things are effective and aren't effective? We're seeing homemade masks, and I've seen people in the grocery store wearing just the rubber kitchen dishwashing gloves. Um, what is recommended? What is effective? What is not effective?
That's a great question. I'll say that our guideline in New York City has been to wear a face mask when you go outside and are going to be around other people. And that's been the general guideline that we've been living under now for a few weeks. I think that's a good general one and probably could be applied in many other places. I think it's very poignant in New York City because the population density is so high. You have to ride elevators. You can only fit so many people 6 feet apart when you come to a crosswalk. There are a number of things that are kind of hard to socially distance, when the population's that dense. Uh, as far as what's effective with the face masks, I mean, there are medical ones, of course, but we've generally been told to avoid those in the general population because we really need those on the front lines with healthcare workers and frontline people. And so, uh, other things, it seems that cotton is fairly effective. A combination of cotton with a coffee filter like paper, either one that's made commercially or one that you make yourself, seems to be fairly effective. In general, something that would cover the nose and mouth and provide some protection. I'll say that with face masks, it's really important you're also really doing it for other people. I think it's one of these things that's maybe a little bit hard to explain, but when you wear a face mask, if you cough or sneeze, then you don't spread as many infectious particles and for not as large a distance or as great an area. If everybody's wearing face masks, then even the people who have it and don't know it will be less likely to transmit it. And that's probably the biggest benefit, honestly, from face masks. Uh, there are news stories, and I think they're true, that most of these face masks, especially homemade face masks, are not going to be 100% effective if you were exposed to a large burst of coronavirus, and that's true. Unfortunately, but having something that you can do to help yourself and help everyone else is really positive, and we've been encouraging this because again, it really helps us all when people are all wearing masks. It just makes all of us less likely to transmit it, and we don't. Unfortunately, we really don't know. You can have it and be asymptomatic, meaning no symptoms, and it's been shown that you could transmit the virus. So unless you apply this to everyone, then it's not going to be as effective. So that's really, I think, the best advice about face masks. I think gloves are fine as well, and avoiding contact. I think that that's also a wise idea. I'll say that in New York, some of the places of business have done a really good job with this. I've seen stores where they actually have cotton swabs available so you can press the keys on the pin pad for the credit card payment instead of having to use your finger. Of course, wearing gloves provides a similar level of distance between you and contact. So that's, I think it's good general policy. I think depending on where we go as time moves on, the face mask policy may be able to be more lenient, but I think for right now, where some areas are experiencing some of their peaks or have just gone through, that makes a lot of sense to try to prevent transmission.